So I may be one of the few people who has been in recovery for several decades who's never been to an AA meeting.
Oh, really?
Yes.
And how did you accomplish that? Welcome to Pillars of Beings, and today we have Wendy Jones, the Executive Director of MARCO, Minnesota Association of Recovery Organizations. And Wendy, if you can tell us a little bit about what you're doing, some of your background, and why you do what you do, I think that would be very helpful.
Sure. I'll first correct you that it's the Minnesota Alliance of Recovery Community Organizations.
I stand corrected. Do we want to redo that?
It's up to you.
Oh, no, it's okay. I make mistakes. I'm human.
Okay. All right. But you can just call us Marco.
Yes.
So that's a lot easier to
thank you
remember.
for saving me.
Sure. So you want to know a little bit about my background?
A little bit about you, the organization,
Yeah.
and why you do what you do.
Okay. I am a person in long-term recovery. So that's first and foremost probably the important thing. I have been in recovery. I've started saying now that it's been since the last century.
Welcome.
Because it's been a while. But I didn't really understand recovery or what that meant, or it wasn't a huge part of my identity until probably about, I want to say like 8 years ago. And I think a lot of that's just because of the shame and the stigma around it.
Right.
I also had a lot of recovery capital when I found recovery. I was employed. I had, a good circle of friends. I had health insurance, which enabled me to find treatment. And I didn't lose my circle of friends when I found recovery. They were very accepting and supportive. My family was very supportive. So I may be one of the few people who has been in recovery for several decades who's never been to an AA meeting.
Oh, really?
Yes.
And how did you accomplish that?
It was a very solitary experience for me. And a lot of that, I think, was the shame, too. And also, this is interesting. Maybe we'll come back to this. When I first met with a health professional, a therapist, around my substance use disorder way back in the 90s, she said something really interesting, which has often stuck with me. She said, yeah, AA and 12-step programs don't always work as well for women. And I was like, oh, what? She said, well, because a lot of it is about giving up power. And for women, that's not a big deal.
Oh, my gosh. That's impactful.
So that's always stuck with me. And for whatever reason, I didn't feel the need to go to one. I did a one-on-one treatment program. It was through an organization called Create. And it's a local provider. But their whole concept was, we want you to find chemical health. So I went into it thinking, maybe I can find a healthy relationship with alcohol. And I think that's what I needed to even be able to start treatment, because the thought of never drinking again was terrifying to me. It was a huge impediment to even starting down a
little bit of
recovery
resistance
path.
there, huh?
Yeah, I could not imagine life without alcohol. And so this program had you set your goals. What did you want to accomplish? And you had to agree while you were receiving treatment that you wouldn't use substances. But they never said, you'll never use substances again. And so that's what enabled me to get going. And we really worked on my goals around that. And then, of course, by the time I got into the program, I realized, oh, wow, I can't have a healthy relationship with substances. But I had developed enough skills at that point to be able to start managing my recovery.
How long did that take?
I was seeing someone, it was interesting because they said you could either do a group, and I would be the only woman in the group, or you could meet one-on-one with a counselor.
At least 50%.
Yeah, yes. So I met one-on-one with a counselor for about, it was outpatient, it was about 7 months, which I'm really grateful that I had that opportunity. And again, I had health insurance that helped to cover the cost. What really did it for me, though, was finding something to replace the use, right? So I remember my first night of not using, I went to Lake Como over in St. Paul. I had like a beat up old pair of sweatpants, and I just started running around the lake. And so in those early years, running was something that was really, that was my path to recovery in a lot of ways.
On a running path.
Yeah, I was on a running path. And I've had kind of this love-hate relationship with running ever since. I've gone through phases where I've been a runner. I'm not right now, but I've done 12 marathons, and that was part of my healing, was finding that physical connection to something. So that's my long way of saying I've been in recovery for a long time, and it maybe not the most typical journey for a lot of folks. And I realize now that it was because I had so much recovery capital, that I had deep wells of support from my friends and my family. And even though I didn't talk about it with my employer, I had resources there. And so at the time, I was employed by the Minnesota Historical Society, and I worked there for almost 30 years.
Wow.
Yes.
And you still went back to work after that.
Yes. Yeah. I was one of those very successful individuals with a substance use disorder. I managed to keep moving up in my career. And this is another thing that my initial therapist said to me when I described my patterns. She said, "Oh, you're like a lot of women in that you're a private drinker." So for me, it was always, it didn't fit with my image, so I wasn't so much the go out and party, woohoo, but I was drinking alone to the point of self-destruction every night. And so that kind of hiding the two Wendys, the public facing and the private, when I knew that I couldn't do this anymore is when those worlds started to collide, and it was impacting my work and my experience.
How many years into the 30 years did that happen?
That happened, let me think here. It must have been 6 years into the 30 years. So, yeah, and I'm really grateful for all the years I had with that organization. Right. I entered at the entry level being a tour guide. And then when I left 30 years later, I was the director of education. I oversaw a large division with 6 different departments in it, and was part of some amazing experiences during that time. Got to open the History Center in 1992, was part of building and developing Mill City Museum, which opened in 2003, 2005. Oh my gosh, I've forgotten already. But at a certain point, you realize I've spent my entire life with one organization. I've grown up in this organization, and you begin to wonder, can I do anything else? And around that time, 2016, 2017, lots going on in the world at that point, and as is today. And I really started to think, what's your purpose? What else can you be doing more of to make a difference? And I felt like I had made a huge difference with the Historical Society. I do really believe in the power of history and knowing your history. and being empowered to tell your own history, that actually, when you think about it, dovetails really nicely with recovery.
Yes.
It's about agency and efficacy, self-efficacy, and being able to take control of one's life. And so all that I learned from the world of working in history and museums and the importance of communities telling their own stories and the importance of knowing where you came from and how that could be a source of strength for you, that led me to the world of working in recovery in kind of an odd way. I saw this organization, Minnesota Recovery Connection. I think I saw a job posting there, and I was like, what is this? Yeah. I'd never heard of a recovery community organization before. I was really intrigued by, it's a nonprofit, it does advocacy, it does community-based work. A lot of that aligned with what I had been doing for the Historical Society. And I saw that they offered a training on how to be a recovery coach. And I thought, I could volunteer as a recovery coach. That might be something meaningful for me to do. And so I took a week off of work from the Historical Society, and I went through the recovery coach training, and it blew my mind. It was a true paradigm shift. I had been not using substances for a really long time at that point. And I realized I had never really understood this as a system problem. I had seen it as something personal and shameful, and it was my individual experience. And this training helped me to understand it as a system, that it's a chronic medical condition, understanding the science behind it, understanding the intersection of substance use disorder with every aspect of our society, from capitalism and the making money off of people who are addicted to substances, to our criminal justice system, where we tend to incarcerate people instead of treating them for their disease, to structural racism and the impact that has on substance use disorder and recovery. I had this moment where it occurred to me, when I was in active use, I'd been stopped by the police several times.
And how did that go?
I never got a DWI. I never got a ticket or was arrested. I should have been. I was stopped a few times when I was very much under the influence. But maybe I'm a great actor. I don't know. But I think what the police saw first was, here is a young white woman. She's late to work, or she's, going a little too fast. And I honestly believe that it was something I had no control over. I can't control that I was born white and born a woman, that caused them to treat me differently. And I'm quite sure that if I had inhabited a different body, I probably would have a criminal record and might have received my treatment through the Department of Corrections instead of through a private treatment provider.
Right.
And this experience of going through this training to be a peer coach, it really dug in to a lot of the biases that we have, and it challenged me to think about recovery in a whole different way. And so around that time, I'd completed the training. I was doing other volunteer work for Minnesota Recovery Connection, and I was increasingly dissatisfied with being at the Historical Society.
And what was that other volunteer work?
I did outreach for them. I actually helped them with a couple grants, so I didn't do a ton of the actual peer coaching.
Right.
I did more. I used my other skills to support the organization. And I also left the Historical Society. So
you had time on your hands.
Yeah, I took advantage of a situation at the Historical Society where they were offering some layoffs, and I used that opportunity to explore a career change. And I was looking at other nonprofit work. I, did some policy work during that time. I became a Humphrey Policy Fellow, which is a cohort of individuals from different sectors that really work around policy issues. I got a fundraising certificate from St. Thomas because I wanted to do more, executive work. And I was sitting with the acting executive director of Minnesota Recovery Connection at that time, Chris Kelly, and I had coffee with her about a volunteer project. I had an idea in mind. And they were hiring at that point. Chris didn't want to be the permanent, that had been a co-director situation, and the other co-director left, and she wanted to go back to being program manager. So they were hiring for an executive director at that time. And she, at one point in the conversation, said, "You should apply for the executive director position." And I said, "I don't have a background in behavioral health. I mean, I'm a public historian." But I did have a background in nonprofit operations. And she said, "That's actually what they need right now." And so, I started as the executive director there in January of 2018. And I like to say it was the equivalent of, like, you took high school French and 30 years later, you go to France.
And you forgot all your French by then.
And you can maybe understand one or two words. I felt that way entering the behavioral health space because everything is acronyms. And, I learned about like CMS and LADCs and arms workers. And, this was a whole different language for me. And I started to pick up on, I think I know what that means. I think I understand that word. So the first year was really not just trying to get the organization back on track as a nonprofit organization, but for me also getting deep and learning about the behavioral health space and learning about that unique role that recovery community organizations play in that, because they are not clinical. They're intentionally not clinical, and they're led and governed by representatives of the recovery community. And they really fill these important gaps in the system of providing low barrier, low threshold support services, peer recovery support services. But they also do public events and public education and policy advocacy. And so they're really these like one-stop shop recovery hubs in communities that are not only serving individuals, but they're trying to till the soil of their communities. And I think the best analogy there, Don Koyas, who was the founder of Wellbriety and White Bison,
can you tell us more about?
It's an indigenous recovery movement acknowledging the cultural strengths of indigenous communities, and it's a pathway for recovery. I bring him up because there's a quote of his that I use all the time, which I think really explains recovery community organizations. And it, I'll paraphrase, but it's if you take a tree that's dying and you dig it up and you put it in a nursery and you tend to it, you water it, you give it everything it needs, and it flourishes in that nursery. But then you take it and you replant it in the same soil.
Yeah.
It dies.
Yeah.
Because it was the soil that wasn't healthy. And that's often the approach that we have with people experiencing substance use disorder, is we pull them out of their communities, we put them in treatment where, like, oh, everything's taken care of. You've got everything you need.
I've heard it's the treatment bubble.
Yeah, exactly. The treatment bubble. Then you put them back to the same community that supported and sustained their substance use disorder. It's really hard to flourish. And so recovery community organizations they're out in that soil, right? They're trying to create this space that's healthy and supportive, and to change the soil to create a positive community for people who who leave that protected environment, or maybe they need help getting to that protective environment. So being in that RCO space, I've learned so much over the past, what is it now? Is it 2025 now?
Yes, it is.
Yeah.
Welcome.
I've learned so much over the past 7 years, and really believe I see it in action every day. The power of these nonprofit, community-based organizations that are no barriers to support. Like, I don't care if you have insurance. They'll meet you where you are. They honor all pathways. They're not intended to say, you have to do this. It's like, where are you right now?
Right.
Where do you want to go? How can we help you get there?
Right.
And that it's not a top down. It's not the state saying you need to do this, this, this. It's, we're from this soil. We're from this community. And we also know where the strengths are. Because I think often we overlook that, like with Don Koyas and the Wellbriety movement, the strength that's in specific communities, and how to leverage that and use that and embrace that to find a path to long-term recovery. So that has really inspired my work in building Marco, which is a separate organization.
Well, let's get to Marco. But first, can you kind of finish out the story? It's okay. You keep talking. We'll adjust.
Okay.
Can you kind of finish off? So you started as executive director.
Yeah.
At
Minnesota Recovery Connection.
Yeah, MRC. Yep. And they needed somebody like you. Why did they need somebody like you? With your experience. Yeah,
because a lot of recovery organizations are founded often by people with a lot of passion, and maybe not the practical experience of nonprofit organizations.
What does that mean?
So it means understanding nonprofit accounting and financial operations, and building diverse funding streams that enable you to deliver on your mission. It means understanding the complexity of your communications, and how you have to have different platforms to engage a broader audience and to build that support. Basic fundraising principles, the difference between an event and sponsorship versus individual donor cultivation versus applying for state and federal grants.
I am tired now.
I know. It's
wow.
It's a lot. And then basic human resources issues, having infrastructure to be able to hire people. And what if you have to let those people go? And how are you protecting yourself legally? And so that was kind of, there wasn't a solid framework for a lot of those things at Minnesota Recovery Connection. When I started, there was some, but the organization had reached a point where it was going to collapse if it didn't shore up that framework.
Collapse from their own success? Or collapse from their own mistakes?
Both. I'll just leave it at that.
That was my next statement. We're syncing up good.
Yep. So, It needed someone who had that kind of savvy of organizational operations and also
in the nonprofit
nonprofit sector. Yeah, because nonprofits are different animals. And for anyone to say that running a nonprofit is easier than running a for-profit, I will challenge that. In fact, I think it's harder because you've got a double bottom line. You have the bottom line of we're still a business. We have to, the books have to even out, right? You have to make money.
At least
even out. And then you have to have a reservoir because your funding is constantly shifting. Like, oh, that grant ended. Now what do we do? I have to be prepared for the next source of funding. So there's that bottom line. But the other bottom line is your mission. Like, you're accountable to the public as a nonprofit, to the people that you serve. So how are you showing that you are meeting that mission? And that's where the trust and the faith comes in for your communities. And so that double bottom line is critical for nonprofit organizations. And
they needed
a little dose of that.
A little dose.
Yeah, I mean, I talk to a lot of people wanting to start recovery community organizations, and I'm kind of Debbie Downer sometimes. I mean, my first...
What are you thinking?
Yeah, well, I mean, my first thing is somebody already doing this? And how can you use your talent and your energy and your passion maybe to partner with or to support where that's already happening in your community? Because unless there's a really strong niche or need that you're filling, you should be prepared that it's incredibly difficult to sustain a nonprofit. It's not that hard to start one. Like, you can file the paperwork and yay, I'm a nonprofit. But actually building one and sustaining it so that you are true to a mission, but you're also economically viable, because you can't deliver on your mission if you don't have the resources to do that. That is so hard. And there's an accountability in nonprofits.
Yeah.
You have to file, your 990, your public, all of your financial operations is public information. You are accountable to each different funder. They want to know, what did you do with that money? Show me exactly. So keeping track of different pots of money and how they are used for specific purposes. It's much more complicated than, our books balance. It's your books balance, and you have to be able to show different funders where your money went.
Right. So how did you figure out where to start?
Well,
After you started.
First, I really was so grateful to be standing on the shoulders of giants. I mean, there was a lot of vision and hard work that had already happened. And the previous executive directors, from the founding executive director, Nell Hurley, to Julia Alexander and Chris Kelly, who were the co-executive directors, they had built a lot of great stuff. So I have to acknowledge that being able to step in and stand on their shoulders was huge. And I think every leader needs to recognize that you 99.9% of the time are standing on the shoulders of those that went before you. And so Chris Kelly in particular, she stayed on as the program director for a few months after I started, was an extraordinary mentor for me. And so starting first to understand what had already happened. I'm a history person, right? So
yes,
how did we get to where we are? And I think that a good leader takes that time to listen, to investigate, to look, to know that you may have come in with some biases, or you may, like on the surface, think, well, that's got to change. You have to do the work to understand, like, how did it get to that? What are the circumstances that supported that? And
was there any resistance to you doing that, trying to understand?
A little bit. I think a lot of people were ready for change, and it was small. They'd just been through a really difficult financial time. So there really were only 4 staff, including me, at the time. And there was so much potential for it to grow. It had downsized recently. It had some difficult financial times. But the biggest, I think everyone knew that, because our biggest challenge was it was about to lose in a year and a half its primary funding, which was a grant through the Department of Human Services. And that was a bigger political issue, that the Department of Human Services was no longer using block grant funds to support recovery community organizations.
Well, that's a seismic change.
It is. And part of the rationale there was that the state had enacted legislation that made peer recovery support services billable to Medicaid. And what was unique in that was that it allowed recovery community organizations to be able to bill Medicaid for the delivery of peer recovery support services.
And that's another seismic
change. And the initial intention behind that was, you've got these great organizations, RCOs. It could ease up some of the pressure on their funding if they could get a little bit of a revenue stream for something they're already doing, providing peer recovery support services. But that narrative quickly shifted to you should be able to function independently with no further support from the state if you bill for peer recovery support services.
Was that intentional from the legislature, or just kind of?
Not from the legislature per se, but through the Department of Human Services.
Okay.
Because they had previously used a portion of the block grant funds, because every year SAMHSA gives chunks of money, federal money, to states.
And can you help us understand who SAMHSA is? I mean, I do.
Oh, thank you. The Substance Abuse and Mental Health Services Administration, which is the federal agency or department that administers federal money related to mental health and substance use disorders.
Thank you for that.
Yeah. And one thing that SAMHSA does is the state gives blocks of, the federal government gives blocks of money to states based on metrics. Not every state gets the same, but it's based on population, based on other metrics of need in the state around mental health and substance use disorder. And the state has a fair amount of discretion in how it uses that money. It has to report to SAMHSA, here's how we're going to use it. And in Congress, they do require that Congress passed a law that 20% of that has to go to prevention. But there's no other requirements that it be spent on recovery. In recovery, I mean things like recovery community organizations or recovery housing or collegiate recovery programs or recovery programs for students, as opposed to treatment. So most of the block grant dollars go to other things right now. So it had been funding some recovery community organizations. And when that shift happened, that was one of the things that mobilized me and a few of the other, there was only 1 or 2 other RCOs at the time, was to change that narrative. You can't do everything an RCO does and be sustainable on billing Medicaid for peer recovery support services, because there's a very small window of what's billable.
Right. And if I understand correctly, Medicaid money, once again, is given to the states.
Yes.
With some guidelines, but they have flexibility within that to expand, shrink, or how they...
Right. So the state had to get permission to use Medicaid money for peer recovery support services. So that was part of that hadn't been in place in Minnesota prior, but they went through that process of first putting it in legislation and then sending it to the CMS, the Centers for Medicare and Medicaid Services. That got approved. Then there was an amendment to our contract, the state's contract essentially with Medicaid. And now I can just feel the audience zoning out.
Yeah. So that ended up with being able to bill for what RCOs already were doing.
Right.
And DHS said, well, now that we're allowing you to bill, you don't need our money anymore.
Right.
And so now you're dependent, instead of a grant, which we have a lot of flexibility on how we want to use, we have one focus, one stream.
Right. A disproportionate emphasis on billing for peer recovery support services became the situation in Minnesota.
Yes.
And that was problematic in a lot of ways. One, that it didn't acknowledge all the other work that RCOs do, and that they serve people who aren't on Medicaid. They serve people who maybe don't want to get an assessment. It's a fairly humiliating experience to get an assessment to say that you have a substance use disorder.
Right.
Their philosophy is we meet you where you are, and that means whether you do or don't have insurance, whatever pathway you're trying to follow at this time, whatever you need to take that step forward. So it was kind of asking RCOs to be more clinical, and many have integrated it successfully. I don't know any that can fully function just on billable services alone. But it was things like this, and I'll kind of come back to the original narrative that Minnesota Recovery Connection, when I was the executive director there, was facing this funding cliff. And so we had to do a lot of advocacy with the state around dedicating state dollars to RCOs, because the federal money that the DHS was using, they weren't going to use anymore. And also with Minnesota Recovery Connection, I was trying to diversify the funding streams. They were much too dependent on that grant.
Right.
So building some foundation support, fee for service, there's some trainings that the organization offered, really building the organization's financial accountability, which had been there wasn't great record keeping there. But also leveraging Minnesota Recovery Connection's position to help grow other RCOs. So
was that a shift from
their
original charter?
I think that the shift that I and some others were pushing for is to get out of a scarcity mentality, because around this time, more organizations were popping up. And at first there was, oh, wait a minute, if there's more RCOs, that's going to mean less for me.
Right.
And we had to push past that, because there's so much need. There's, if we always operate under the mentality of there's only so many resources for recovery, it's a pie, and if you get a slice, I'm not getting a slice, we're never really going to be able to serve the community or change the paradigm. So starting to put ourselves out there, help other RCOs to help everyone. So I had an opportunity for a grant, the state money that was allocated for RCOs, in a grant to write in a couple other RCOs. And so one was in St. Cloud and one was in Duluth. And they had no other access to resources to kind of get them up and running. So I built them in to the grant. And that enabled them to kind of get going in their services. I had an opportunity with an amazing employee, Fahia Badul, who was working on a housing program at MRC at that time, Minnesota Recovery Connection. she wanted to start her own RCO for the East African community. And I kind of gave her that space, knowing that she was going to leave MRC at one point,
Right.
to build some programming to work on developing a recovery community organization that was specific to the East African community. And when she was ready to go,
She took the program with
she
her?
took the program with her. And that again is about having a mentality of abundance as opposed to scarcity. There's a part that like, hey, that was our program. But I think you have to dig deep and say, no, this needs to go. This leader is ready to, they can do so much more if you untether them from the constraints of your traditional organization, and then untether but support.
So it's like you were an incubator.
In some ways, yeah. And or a mentor. I mean, I think that was a position that I had positionality. And
I never heard that before. That's good.
well, we were the oldest RCO. We were established, better recognized, and tried to use that positionality to lift up and to draw attention to other RCOs. Was I doing the work in the community? They were doing that. Yeah. So I don't ever want to say that, Minnesota Recovery Connection or I built these other organizations. Hell no. That was happening.
No cussing.
Oh, sorry. Heck no.
Because I've been told no cussing.
HE double toothpicks. I think removing barriers, that's what I thought was important.
Right.
I don't want to take credit for any of that work. And I'm so proud of the work that all these other organizations have done. If I had an opportunity to draw attention to them in a good way, and to get them in front of power brokers, or to remove a barrier by building someone into a grant or being a fiscal administrator for an organization, I tried to do that. And it was sometimes met with suspicion. So
yeah, I think in some of our previous conversations, it's like this was the genesis of Marco.
Yes. Yeah.
Which you had a lot of resistance to initially.
Yeah. Yeah.
And it's going to be interesting to get to the point of what kind of flipped that. But
yeah,
I'm gonna let you, don't go there yet. We want to hold off a little, build some suspense. So can you talk a little bit more about, where that went to next within MRC?
Yes. As more organizations started popping up, I was the director of Minnesota Recovery Connection, which sort of by default had this statewide presence because it had been the only recovery community organization for a while. And again, it was the oldest, it was the most established. We were using Minnesota Recovery Connection as kind of an anchor to facilitate conversations with the organizations that were popping up. And so it started as a community of practice. There was a lot changing, billable services and regulations coming out of DHS, new organizations that needed help setting things up. We tried to, we got together on a conference call, pre-Zoom, pre-pandemic, monthly, and just talked about, what are you working on? How can we help promote that? Do you have this resource? Would you mind sharing your position description with me? Things like that. Kind of coming down to the fact that, like, why reinvent the wheel? If one organization has this, if they could share it with you, it saves you all that time of having to create that from scratch. And we're making each other better in doing that. So this sort of informal working together started to happen. There were little inclinations of what are you trying to do? Is MRC trying to take over? Which were fair. It certainly could appear that way. And there was some talk like, oh, maybe MRC becomes more of a statewide organization with these official relationships with other RCOs. And I had had some tough conversations around that. And that's when I had to kind of step back. Sometimes you got to get up on the balcony and look down and like, oh.
I didn't see that coming.
I didn't realize I was such a bad dancer over there. But some self-reflection, like, who was I? Like, I came in, I didn't build this organization. I realized I was the only RCO director at that time who had not also founded the organization. And that's a different perspective.
It's a credibility word.
Yeah, it's a credibility. It's also there's a different level of ownership, and I can see protectiveness that I was thinking, well, of course, we can just share this, share that, but I hadn't used my life savings to build this organization from scratch. And I needed to really step back and honor that and acknowledge that the work of these founders out in their different communities, oh my gosh, that needed to be honored and recognized. And I could see where there would be resistance to having an existing RCO kind of become this new entity that represented all the RCOs. Right. And so as we can talk about the landscape changing a little bit, as individual organizations started to realize, we need to speak with one voice. We really need to work together because our very existence is being threatened here.
Threatened by?
By lack of funding, by legislation that might potentially just change the definition of an RCO, and by others kind of co-opting, not necessarily always for good purposes, the RCO status for financial reasons, to be able to bill for peer recovery support services.
Let's address the elephant in the room for a moment.
Yeah, sure.
It was fraud.
Yeah, I mean, there was...
Not to belabor it, but...
Yeah. There was a lot of, and these things are still under investigation, so right. That's all I can say. Right. But it was not a particularly rigorous process to get the identification of what an RCO is. With understandably, because when the state said, "Oh, RCOs can bill for Medicaid," again, there were only 2 in Minnesota at that time. The requirement that they had to be eligible was that you had a membership in a national organization called at that time it was called the Association of Recovery Community Organizations, or ARCO, which is a program of Faces and Voices of Recovery, which really is the organization that has been leading the RCO movement since 2001. So it's been at the forefront of defining what an RCO is, of building those national standards. So the only requirement was a membership, which, memberships are one and done. They're voluntary. Like, oh, I meet these, yes, I do these things. Okay, you can be a member. So there weren't site visits. There weren't extensive vetting of the organizations. So you started to have some organizations that got memberships, and then there was never any follow-up. Like, once you're a member, I can do...
No accountability.
No accountability, yeah. And some organizations got rejected for membership, primarily because they had an affiliation with a clinical provider. Because that's really at the core of being an RCO, is that you're an independent, non-clinical, nonprofit.
Right. Thank you for clarifying that.
Yeah. So because they want RCOs to be able to act independently in service of the community. And if there's too close of a clinical connection, then the question becomes, does the RCO exist only to keep people in that clinical environment? To be like
And that can dredge up a whole nother level of bad behavior.
Yes, yeah.
Yes.
Yeah. As opposed to, so the purpose isn't to drive people to that treatment or clinical provider. The purpose is to support that individual in whatever pathway. So as some got rejected because primarily they were too close to a clinical provider, the whole question of this national organization, which is a membership, and really has no relationship with Minnesota, and it's weird, politics and eligible vendor status and billing Medicaid. There was frustration that this national organization wasn't close enough to what was happening in Minnesota. So there's just general frustration.
Right.
And it would be maybe a 6-hour podcast if I went through all the, the details.
That's 3 months from now.
Okay. to cut to the chase, they really sort of cemented why the recovery community organizations that had been operating for a while and with fidelity to the model really needed to speak with one voice and to advocate, because the model works, and it was being corrupted by other interests, corrupted by financial interests. Because anytime you put money in there, and nobody really cared about RCOs until there was money.
Amazing how that works.
I know. So even before this original group of about 8 RCOs filed as a business with the Secretary of State and filed for nonprofit status, even before Marco became an official entity, we started calling ourselves Marco. And that was important because a lot of legislators or the state, why should I listen to this one organization? It's just you. I want an organization that represents you.
So it wasn't a chicken and egg or egg and chicken. It was just kind of happening at the same time.
Yeah.
The one voice.
Yep. It was over a period of a couple years, sort of organically grew. And also during that time, learning to trust each other.
Right.
Because remember, I talked about before that scarcity mentality. And I think we had to sort of be in the trenches with each other for a while and learn to trust each other. And also realizing, more is more. There's no shortage of need.
Right.
The important thing is that need is being met with services that are operated ethically, with fidelity, that are committed to that vision of tilling the soil. Like I said, that they're committed to change in our communities.
And the legislature blatantly said to you or your team, we need one voice from your community, pretty much.
Again, in there, Minnesota Recovery Connection had had gotten a couple legislators to sponsor a bill that would provide some infrastructure funding for RCOs. Again, kind of hitting at billable services don't support all the things that RCOs do, and don't support building that infrastructure that's needed to be a successful organization, like being able to recruit volunteers and have meaningful things for volunteers to do, because volunteers are then giving back and strengthening their recovery and developing skills. And, so that's not something you can bill Medicaid for.
Right.
But that's critical to creating community and strengthening community. So we had gotten successfully passed an appropriation of money that was going to support RCO infrastructure, which would be distributed by the Department of Human Services through a competitive request for proposal process.
And out of that came Marco.
Out of that came Marco. So the Department of Human Services said, you know what, we're going to take a chunk of this money and we're requesting applications for a statewide recovery community organization that would do professional support, technical support, and certify RCOs, build a certification process.
Which was kind of code word for let's try to prevent organizations taking advantage of financial.
Yeah, I think, yes, it was code for that. We need to get a grip on this. And the state isn't equipped to do it.
And that was only one part of the charter for Marco.
Right. The other part is that mentorship, and that, you know, our mission is to educate, advocate, and mobilize resources to grow the grassroots recovery movement in Minnesota.
And so you were taking your 30 years experience at Minnesota Historical Society, the infrastructure you built at MRC.
Yes.
And then you were taking all that together and
building Marco.
Again. You seem to like doing that.
I'm a builder. I totally am a builder. Yes. Yeah. And again, standing on the shoulders of giants and having just...
And you have pillars and beams in your buildings, right?
Yes, we do. Pillars and beams.
Good at this.
Good connection there. It was an extraordinary group of people who brought Marco together. And we had leadership from RCOs in Rochester, Minnesota, in St. Cloud, in Duluth, in the Twin Cities, in Mankato. And, that original board of directors took a big leap of faith and, planted a stake that said, this is what we stand for, and we want to use our collective knowledge and wisdom to build this system.
The collective knowledge and wisdom was amazing, I'm sure, but can you help me understand better how you took what you learned at MRC, and I'm sure you had to adjust it to get Marco off and running. I'm sure you didn't have a lot of ramp up time for Marco. I mean, it's like the funding's here and the funding's going to stop here, so we need to get this done. What are some of the key things that you did from the learnings from MRC to get Marco going up?
Yeah, I think, in true transparency, it took me a while to transition out of MRC. So I was kind of supporting, I was mentoring the new executive director there as I was trying to get Marco up and running. So very straightforward things. There's a whole bunch of administrative stuff in building a new nonprofit. And so getting all that. And
that's something that have a proven track record outside of the state and working in the RCO community.
Being able to do that.
Yes.
There were some programs from Minnesota Recovery Connection that the MRC Board of Directors approved, having those move over to Marco, because remember, MRC had done more of that statewide advocacy.
So that helped
role.
Ramp up.
That helped that I just took those.
Right.
So that includes like Recovery Day on the Hill and the Recovery Advocacy Workshop. The biggest thing with Marco was building the certification. And
certification for
RCOs. So building a process that would enable that the RCOs would go through to be able to determine are they executing these core principles, these core activities of an RCO. And we wanted to get input from, stakeholder input. I've learned that throughout my entire career, not just at MRC. I had some money in my budget to be able to hire a third party to do that, because I also wanted to acknowledge, again, my positionality, that if I were to go out to all these other RCOs and say, hey, what do you need from a certification process? I don't know if they would feel as comfortable being, because it could be like, we don't think it should be you, which is fair. So having a third party do that enabled
Right.
us to get a lot of different perspectives. And so that was the first step.
Yes.
Is we had the third party not only survey, but do in-depth interviews. So I contracted with Mighty Consulting, which has done a lot of work in the behavioral health space in Minnesota. And so they did interviews and surveys with organizations that had been denied by RCO, with organizations that had been challenging us
Right.
throughout, as well as with some of our current board members. So we really wanted all these.
Right.
You got to hear the ugly in there too.
Yes.
That's really important. That's a big tip. Is you can't ignore it. You got to bring it in and accept it and work with it. So we got that stakeholder input, and that helped to inform what the process should look like. And the big thing that came out of there was that they wanted it to be supportive, and that it should help organizations grow and be sustainable and be better, as opposed to a gotcha. And they really wanted different ways to be able to show what they do. So building Marco, the first part of it was just really getting kind of that stakeholder input about what Marco can and could be and what that certification should be. And we're still in that process. We've got we did a second stakeholder retreat back in November to kind of, again, put a big net out there.
Right.
Like what? And
As you're doing the operation setup and all the fiscal.
Yeah.
So when do you think your certification will launch?
Oh, it's already launched.
Sorry.
Yeah.
I take that back.
So we launched it back in June, almost a year ago.
Okay.
And actually, no, we launched it prior to that. We did
So I was confused. I thought you had it, and then you said you had another stakeholder.
Yeah, so that's, I should back up. So we had stakeholder around the certification, and we got the certification up and running.
Okay.
And now, like, Marco's more than certification. So what else can it do? And so that's what that second round of.
Thank you for helping me with that.
It was a broad engagement around, like, okay, like, what's your why? And what potential does the broader community see for Marco to be able to have an impact?
Right.
And so that kind of helped informed what we call a theory of change. So what if Marco does what it's supposed to do, what can be different in the world? And so we wanted a lot of people to inform that. And now we're working on some strategic planning for our next 3 years. So
what Marco can do for the next 3 years.
Yeah, exactly. Yeah.
So how many RCOs are there now?
There, it's hard to put a number on that. I would say there are about 30 around the state.
You went from 8 to 30 in 2 or 3 years?
Yeah. We went from like 2 to 8 to 30. And of those, we have certified 9, and we have more in the queue.
Great.
So it's a fairly extensive process that's done by community reviewers and includes site visits and yeah.
Well, it looks like we have more to come back to.
Yeah.
Maybe for another podcast.
Okay.
Let's see what. Okay. A little hesitant there.
Yeah, no, Minnesota is an interesting place, and it's both exciting and frustrating.
It reminds me when I worked overseas.
Yeah.
It was amazing and horrible at the same time.
It was amazing and horrible. There's so much.
That was my experience, not Marco.
No, I mean, there's. Sometimes I say it's like why we can't have nice things. Like we took this big leap forward on, like, yes, here's something to support RCOs, and then it was corrupted. And so now we're in this phase of, okay, how do we backtrack and put some guardrails on that? But I want to focus on, we got to have the guardrails, and we are. Where's all the energy and the amazing community work that's happening?
Certifying the rest of the RCOs and
be excited to hear what comes out of the strategic plan, and
Yeah.
we can kind of follow along with that.
And helping organizations do things like town halls. That's
Yes.
what we did with home recovery.
Yes.
Had a town hall focusing on substance use disorder in the Southeast
Yes.
Asian
Yep.
community.
Yep. We have a couple of podcasts on that.
Yeah.
So we're excited to publish that too.
Yeah.
Well, great. I learned a lot of new information and laughed a lot more than I've laughed in
Okay.
a while. And thank you.
And I talked a lot.
No, but you had a lot of good information in there. That was very helpful.
Good. Good. Well, thank you for having me.
Yeah, thank you for coming.